Welcome to the Austbier training program. The aim of these Austbier sessions is to help students feel more comfortable with and be more successful at having a respectful, caring and effective conversation with the patient. In this video, we'll take you through how the site and assessment work and how to use it. The first thing you should do is complete this training. The video training is broken up into sections in the likely order that you will interact with the Austbier program. Feel free to repeat the content or come back to it in the future at any time. It will always be available to you. You will be given a login, likely your email, and a password. This can be changed once you are on the system. Logging in will identify all of your activity on the website and will help us keep track of the work that you do. It gives you access to a calendar to keep track of your appointment times and a portal to review the videos and get or review feedback. This is also where you will begin appointments. There are a number of documents you will need to read prior to beginning the Austbier. These will be provided on your initial login, but are also available in the Program Info tab. The first covers the Code of Conduct, and the second, the Guide to the Interaction. Please ensure these are read and accepted before you continue, and feel free to review them at any time. So once you've gone through those documents, you can start by requesting an appointment. Each appointment is assumed to be a total of 30 minutes. Within this, there will be a pre-appointment survey, the equivalent of a sound check when the system works out that all the technical settings are appropriate and where baseline measurements are made by the system, a short informal introduction with the simulated patient, a 15-minute formal appointment, and at the end of the appointment, you will be asked to fill out some reflection on both your experience and the soccer form the SP will fill out about your interview. To request an appointment with a simulated patient, or SP, you will need to log into the website and click on the Calendar tab. A month calendar will appear, and you will see green boxes that indicate available time slots for appointments. You can click on the time you wish to request, and then click on the Request button that will appear in a panel at the top of the calendar page. Confirm your request, and then the colour of the appointment will change to red to indicate that a request has been made. Appointments are allocated based on your previous completion of Austbier appointments. At the end of each working day, the site forwards these requests to the simulated patients, and you should receive confirmation of your appointment request time within 48 hours. If you do not receive confirmation, that means that you have not been allocated the appointment time, and you will need to request another time. Once a simulated patient has confirmed an appointment, your appointment is booked and will turn blue. You will also receive a reminder 48 hours prior to the interview. If you cannot attend the interview for whatever reason, you need to cancel the interview by going to your calendar, clicking on the appointment time and clicking the Cancel button. It will request a reason for the cancellation. To prepare for the interview, you will need to have the right setup. For the technical setup, you'll need a computer or an Android tablet, a stable internet or Wi-Fi connection, and any video conferencing needs, including a webcam and microphone, should your computer not have these built in. You will also need the right physical space and time allocation, a quiet space where you won't be interrupted once the interview starts for the full 30-minute time. When you are getting ready on the day, make sure you are seated in an appropriate position in front of your device, which should have a working camera and microphone capacity. Make sure you have good lighting in the room on your face. Once you are settled and ready, log in and then click on the Start Appointment button next to the correct appointment time. At this point, you'll be asked to fill in a pre-interview questionnaire. You must respond to each question to continue. You will then be asked to make some casual statements so that we can capture your baseline communication parameters. This is the baseline video. If asked, allow the site to share your camera and microphone. First, make adjustments so that the computer image and lighting means you can see your face clearly. Adjust the camera so the image includes at least your full head and shoulders. Locate and ensure good exposure of the microphone device to pick up your voice. Ensure the sound volume is on so that you'll be able to hear the other person without having to lean in. This can be adjusted later if needed. Once this is all set up, you can just sit comfortably in front of the computer to be recorded. Click the Start button and respond to the question at the top of the screen. When you are done, press Stop. Once you complete this, you'll be redirected to the interview screen, showing yourself and the SP screen. Always allow the sharing of your camera and microphone when requested. As soon as both yourself and the SP have logged in, the interaction begins, as well as the video recording. You should start with an informal introduction. The SP may introduce themselves by their real name in addition to telling you the name of their patient character. When you're both ready, click Start to move into the formal appointment and begin the assessed component. From this point, you need to address the SP as the patient. The screen will change to a full screen view. The interview will continue for approximately 15 minutes. It can finish earlier, but should not go significantly beyond the 15-minute mark. There is a timer at the top of the screen so you can see how far along you are. And you should wrap up the interview at the 15-minute point. If you do not, the SP will likely point this out and encourage the interview to end. Click the Stop button when you're finished. That's the interview done. Now it's time for reflection. Reflection and learning is a significant part of using the Austbier. Following the interview, you will need to complete 3 separate reflection forms by typing answers into the boxes on screen. The first is a personal reflection on your experience of the interview, as well as your self-rating in comparison to your pre-survey. You will be asked to confirm whether this is an assessment Austbier or for practice only. The second is a reflection on the Austbier, where you first provide feedback on the content, the scenario, and the SP, and then provide feedback on the system and structure. Remember, this is not about how you did in the interview. The final reflection form is in response to the soccer form done by the SP. If the SP has not finished the soccer, the screen will let you know to wait, and then you just need to refresh the page after a few minutes. Once the SP is done, you can review the soccer result as a read-only document. When you have finished reviewing it, click Submit, and you will be asked to reflect on the feedback and consider how you will improve your communication skills in the future. Once you have submitted these reflection forms, you have completed your Austbier appointment. However, there is still further learning available to you. By coming back to the system after 48 hours, you'll be able to do a number of things. Click on the My Consultations tab. You will see a list of your previous consultations and can review the following. Each will appear in a new window. The Comments button will allow you to review the video and see the time-stamped comments the SP made, which will allow you to see where in the video they occurred. Click on the comment and then press play, and you'll see what behaviours the SP was referring to. The Soccer Results button will show you the soccer form and also your reflections and plan that you gave at the time. The Behaviours button will provide a non-verbal behaviour communication skills analysis of your video. A series of visual and numerical representations of your communication behaviours over the course of the interview. You can use this feedback to better understand your skills and your limitations and work on the things you need to improve to achieve effective clinical communication with your patients. You can see your individual behaviours and compare how different behaviours relate to each other. At the end of reviewing all of the learning content, click on the Final Feedback button. This will ask you some questions regarding your learning experience. And then you're done.